Please be aware that I'm not a mental health professional. Some of the content discussed includes real people. My opinions are based solely on speculation and conjecture and cannot be held against me by any person or persons that have committed themselves to watching this installment. Viewer discretion is strongly advised.
Welcome to my scientifically ill-informed outsider look at mental health topics. Just a reminder, the people I may talk about in this video are real people. I'm not a mental health professional, and I'm not diagnosing anybody. Merely speculating about what could be happening in a situation similar to someone who is suffering from the topic at hand. Let's get ready to send it.
Premature ejaculation. Diagnostic criteria. A persistent or recurrent pattern of ejaculation occurring during partnered sexual activity within approximately 1 minute following vaginal penetration and before the individual wishes it. Note: although the diagnosis of premature ejaculation may be applied to individuals engaged in non-vaginal sexual activities, specific duration criteria have not been established for these activities. B. The symptom and criterion A must have been present for at least 6 months and must be experienced on almost all or approximately 75 to 100% of occasions of sexual activity in identified situational context or, if generalized, in all contexts. C. The symptom and criterion A causes clinically significant distress in the individual. D. The sexual dysfunction is not better explained by a non-sexual mental disorder or as a consequence of severe relationship distress or other significant stressors and is not attributable to the effects of a substance, medication, or another medical condition. It is important to specify whether or not the disorder is lifelong, the disturbance has been present since the individual became sexually active, or acquired. The disturbance began after a period of relatively normal sexual function. It is also important to specify whether it is generalized, not limited to certain types of stimulation, situation, or partners, or situational, only occurs with certain types of stimulation, situations, or partners. It is also important to specify whether the current severity of the disorder is mild, moderate, or severe. In mild cases, ejaculation occurring within approximately 30 seconds to 1 minute of vaginal penetration. Moderate, ejaculation occurring within 15 to 30 seconds of vaginal penetration. And severe, ejaculation occurring prior to sexual activity, at the start of sexual activity, or within approximately 15 seconds of vaginal penetration. Diagnostic features. Premature early ejaculation is manifested by ejaculation that occurs prior to or shortly after vaginal penetration, operationalized by the individual's estimate of ejaculatory latency, i.e., elapsed time before ejaculation after vaginal penetration. Estimated and measured intravaginal ejaculatory latencies are highly correlated as long as the ejaculatory latency is of short duration. Therefore, self-reported estimates of ejaculatory latency are sufficient for diagnostic purposes. A 60-second intravaginal ejaculatory latency time is an appropriate cutoff for the diagnosis of lifelong premature early ejaculation in heterosexual men. There are insufficient data to determine if this duration criterion can be applied to acquired premature ejaculation. The durational definition may apply to males of varying sexual orientations, since ejaculatory latencies appear to be similar across men of different sexual orientations and across different sexual activities. Associated features supporting diagnosis. Many males with premature ejaculation complain of a sense of lack of control over ejaculation and report apprehension about their anticipated inability to delay ejaculation on future sexual encounters. The following factors may be relevant in the evaluation of any sexual dysfunction. 1. Partner factors. Example, partner's sexual problems, partner's health status. 2. Relationship factors. Example, poor communication, discrepancies in desire for sexual activity. 3. Individual vulnerability factors. Example, poor body image, history of sexual or emotional abuse, psychiatric comorbidity, example, depression, anxiety, and stressors, example, job loss or bereavement. 4. Cultural religious factors. Example, inhibitions related to prohibitions against sexual activity, attitudes towards sexuality. And 5. Medical factors relevant to prognosis, course, or treatment. Prevalence. Estimates of the prevalence of premature early ejaculation vary widely depending on the definition utilized. Internationally, more than 20 to 30% of men ages 18 to 70 report concern about how rapidly they ejaculate. With a new definition of premature ejaculation, i.e., ejaculation occurring within approximately 1 minute of vaginal penetration, only 1 to 3% of men would be diagnosed with the disorder. Prevalence of premature ejaculation may increase with age. Development and course. By definition, lifelong premature early ejaculation starts during a male's initial sexual experiences and persists thereafter. Some men may experience premature ejaculation during their initial sexual encounters, but gain ejaculatory control over time. It is the persistence of ejaculatory problems for longer than 6 months that determines the diagnosis of premature ejaculation. In contrast, some men develop the disorder after a period of having a normal ejaculatory latency, known as acquired premature ejaculation. There is far less known about acquired premature ejaculation than about lifelong premature ejaculation. The acquired form likely has a later onset, usually appearing during or after the 4th decade of life. Lifelong is relatively stable throughout life. Little is known about the course of acquired premature ejaculation. Reversal of medical conditions such as hyperthyroidism and prostatitis appears to restore ejaculatory latencies to baseline values. Lifelong premature ejaculation begins with early sexual experiences and persists throughout an individual's life. In approximately 20% of men with premature ejaculation, ejaculatory latencies decrease further with age. Age and relationship length have been found to be negatively associated with prevalence of premature ejaculation. Risk and prognostic factors. Temperamental. Premature ejaculation may be more common in men with anxiety disorders, especially social anxiety disorders, social phobia. Genetic and physiological. There's a moderate genetic contribution to lifelong premature ejaculation. Premature ejaculation may be associated with dopamine transporter gene polymorphism or serotonin transporter gene polymorphism. Thyroid disease, prostatitis, and drug withdrawal are associated with acquired premature ejaculation. Positron emission tomography measures of regional cerebral blood flow during ejaculation have shown primary activation in the mesocephalic transition zone, including the ventral tegmental area. Culture-related diagnostic issues. Perception of what constitutes a normal ejaculatory latency is different in many cultures. Measured ejaculatory latencies may differ in some countries. Such differences may be explained by cultural or religious factors as well as genetic differences between populations. Gender-related diagnostic issues. Premature ejaculation is a sexual disorder in males. Males and their sexual partners may differ in their perception of what constitutes an acceptable ejaculatory latency. There may be increasing concerns in females about early ejaculation in their sexual partners, which may be a reflection of changing societal attitudes concerning female sexual activity. Diagnostic markers. Ejaculatory latency is usually monitored in research settings by the sexual partner utilizing a timing device, example, a stopwatch, though this is not ideal in real-life sexual situations. For vaginal intercourse, the time between intravaginal penetration and ejaculation is measured. Function consequences of premature ejaculation. A pattern of premature ejaculation may be associated with decreased self-esteem, a sense of lack of control, and adverse consequences for partner relationships. It may also cause personal distress in the sexual partner and decreased sexual satisfaction in the sexual partner. Ejaculation prior to penetration may be associated with difficulties in conception. Differential diagnosis. Substance or medication-induced sexual dysfunction. When problems with premature ejaculation are due exclusively to substance use, intoxication, or withdrawal, substance or medical-induced sexual dysfunction should be diagnosed. Ejaculatory concerns that do not meet diagnostic criteria. It is necessary to identify males with normal ejaculatory latencies who desire longer ejaculatory latencies and males who have episodic premature ejaculation. Example, during the first sexual encounter with a new partner when a short ejaculatory latency may be common or normative. Neither of these situations would lead to a diagnosis of premature ejaculation, even though these situations may be distressing to some males. Comorbidity. Premature ejaculation may be associated with erectile problems. In many cases, it may be difficult to determine which difficulty preceded the other. Lifelong premature ejaculation may be associated with certain anxiety disorders. Acquired premature ejaculation may be associated with prostatitis, thyroid disease, or drug withdrawal. Example, during opiate withdrawal. Wow, what a mouthful. And I'm not talking about semen. Premature ejaculation seems to be very, very difficult to go through. Coming within 15 seconds of penetration of vagine sounds like a horrific experience.
I myself do not suffer from premature ejaculation, but I'm sure many of you do. In fact, I'm sure many of you don't, because we read the statistics, and they were quite low. I believe 1.8% between males in my age group. This internet propaganda states that 9 out of 10 men ejaculate within 1 minute of vaginal penetration. I hope for the love of men that this is not true. If you are ejaculating within 1 minute or less of vaginal or anal penetration, or even worse prior to, it is inevitable that your partner will seek out other sexual partners who are able to satisfy. They may even perhaps go as far as to proclaim themselves a hot wife, or more devastatingly yet, turn you into a cuck. Premature ejaculation is a vicious disorder and definitely not a joking matter. I hope this mental health topic has inspired you. If you are suffering from PE, I suggest that through whatever means possible, try to extend your ejaculatory latency to normal levels. This will prevent you from the inevitable internal destruction that will ensue after you have determined that your significant other has established other means to satisfy his or her sexual needs. Now, what can we do about premature ejaculation? I would suggest meditation. Maybe find yourself a nice book, read, have a sit, and a think about how you want to retain the semen inside of you, or you will displease the woman who you are with, and she will seek another sexual partner. I myself hope that anyone suffering from this is able to overcome it. Being as though it's so straightforward, I don't feel there's much for us to say. It's just about letting your spooge out of the tank a little too soon. Well, hopefully we've all learned something today, because that's what Mental Health Mondays are for. Next week, we'll be here to discuss a new topic from the Diagnostic and Statistical Manual, DSM-5, from the American Psychiatric Association. As always, I'm your host, Terrible Troll. Looking forward to seeing you next week. Have a good one. It is important to specify whether this... I'm so fucking burpy right now, it's gross. Bah.